as malaria continues to be a major cause of illness and death globally. Experts in Nigeria have stressed the importance of accurate treatment with artemisinin-based combination therapies, ACTs, for effective case management. The experts, while attending a media chat organized by the National Malaria Elimination Program, a unit of the Federal Ministry of Health in Abuja, highlighted the recommendation among other discussed around the ailment. Correspondent Elizabeth Kasham reports that the event aimed to address ongoing challenges in malaria control and explore strategies to reduce its impact on public health. Her report.
The program officer of the National Malaria Elimination Program (NMEP), Woody Tanko, in her presentation titled Effective Malaria Case Management, Appropriate Use of Malaria Medicines, advised against the use of monotherapy malaria treatment, noting that single drugs therapies not only increases the risk of treatment failure but also contributes to the drug resistance, bringing growing challenges in the global fight against malaria.
When you take your medicines, any medicine that you buy, and you go and you say you want an ECT for malaria, you will see one of those molecules written there. So these are the medicines that are recommended. You can see that there's no chloroquine there is no fancida there is no artemether alone there's no artesunate alone there. They are all coming in combination with other molecules. So once you take your ACTs, it is expected within 2 to 3 days. They are mostly 3 days. Within that time, you should notice that the patient will begin to feel better.
Also speaking, the NMEP National Coordinator Dr. Godwin Intadem explained extensively on malaria diagnosis and treatment while validating earlier presentation that malaria cannot be diagnosed based on signs, symptoms assumption, noting that every suspected case must be tested. Speaking on the nation's journey for malaria elimination, the Assistant Director of Surveillance Monitoring and Evaluation, Dr. Tolulope Fagbemi, attributed environmental mismanagement as a factor slowing the eradication processes.
Notice that if you approach that path, chances of fever are less. So that's why I said one glove does not fit all. It's various strategies. Then again, you also emphasize on the importance of environmental sanitation. When you say people should go and do environmental sanitation on one Saturday, you say, oh, Habib, you finish Habib, you enjoy it, then you finish, you throw it, rain fall, water collects. You will go to that water after a day or two. You will see some black things doing like this inside. Those are mosquito larvae. So you've kept a good reserve of mosquito production plants next to your house, because those ones will grow to come and lay their own.
Federal government through the National Malaria Elimination Program is envisioning a malaria-free Nigeria with the goal to achieving a parasite prevalence of less than 10% and reduce mortality attributable to malaria to less than 50 deaths per 1,000 live births by 2025. Elizabeth Kasham, ASO Television News.